Good evening, I'm Dr. Akl. I'm a cancer specialist in Flint, Michigan. Today I'm going to explain to you why radiation is important in certain cancers. As I mentioned, radiation main advantage or radiation treatment main advantage is preservation of the function of the organ. Today I'm going to speak on cancer of the penis. Cancer of the penis, prevention is circumcision. We see cancer of the patient of the penis rarely today. However, when we see it, traditionally this treated with penectomy, removing of the penis basically. Trickling data started 20 years ago or more showed that if you start radiation treatment, you destroy the cancer, and excellent results, especially if the tumor is early. For advanced tumor, still the treatment is changing now. Chemotherapy plus radiation and assessment for surgery. But for early lesion means the tumor is 2 centimeters, reached the urethra, most common start in the glands, penis, and do some deep destruction. With radiation, you will be surprised that you cure about 90% of early lesions. And when I was a resident at University of Toronto, I reviewed University of Toronto experience of cancer of the penis, and that was published in the International Journal of Radiation Oncology, Biology, Physics. This treatment, again, patient need to ask for it. If patient do not ask for it, they will end by penectomy. The advantage of this treatment is you cure the cancer and you preserve the sexual and urinary function of the penis. Treatment either by external beam radiation, where patient to go for 6 weeks of radiation, 1 treatment a day, 5 times a week, none in the weekends for 6 weeks, or external beam plus implant either radioactive material over the lesion depending on the type of the lesion, and that result in cure of this tumor. And if you look in the literature, a chance of cure in the order of 90-95%, sometimes 100%. As I mentioned, because radiation cure is not known to many people, even to surgeons who deal with problems, the patient need to be the driving to ask for alternative treatment to penectomy or removing the penis. Those patients, once they inquire alternative treatment, they are seen by radiation oncologist who will examine them and see the extent of cancer and assist them for radiation treatment, which is highly effective in curing cancer of the penis, especially if it is in early stage, even for advanced stage, depending on how aggressive is the tumor and so on. Cancer of the penis is a rare disease, as I mentioned, but once it is recognized, the chance of cure is very high with radiation treatment. Penectomy is traditional way, and today's if patient seen diagnosed with cancer of the penis, rarely an option of radiation is presented to them. Simply because nobody knows too much about radiation, and it's a culture like this cancer, let's remove it, even though with radiation treatment there is preservation of the function of the penis, urinary and sexual function, and no compromise of cure. The patients also need to be the driver for asking for radiation treatment for cancer of the penis. Literature show numerous publications in Europe. In Europe, radiation is playing a primary treatment for cancer of the penis. In the United States, radiation is less common, except for big centers where patients ask for alternative treatment to surgery. After radiation treatment, the penis might be a little sore. This will completely disappear the soreness will disappear within 2 to 3 weeks, and there is another peak of side effects which occur 6 months to years. Sometimes there is a little bit of fibrosis or thickening of the penis. With appropriate delivery of radiation, we do not see these side effects, and the penis will be normal. Occasionally, the urethra where the urine come out becomes smaller in few percentage of patients. If that happens, we dilate the urethra, and the problem is not a prominent one. But the majority of patients will get a normal function, sexual and urinary, with no side effects. Those who get side effects, they could be treated, like if they get meatal stenosis or the opening of the urethra is smaller, that scar tissue, this will be dilated. And those who get different degree of fibrosis, rarely fibrosis or thickening of the glands, that rarely alter their sexual function. Overall, the cure is high, the quality is normal or close to normal, and patient satisfaction is excellent, the patient and their spouses, and cure of cancer, as I mentioned, is high. So you got excellent chance of cure, minimum if any side effects, normal function of the penis, and this treatment is recommended. However, because it is rare and is not seen often, when patients get the side effects that are seen and the surgeon recommends to remove it, if the patient agree, that's end of discussion. But the patient need to ask for an alternative treatment, and they need to see a radiation oncologist. If that happen, then the treatment will preserve their surgery, and the patient will have normal sexual function as well as normal urinary function, and the majority of patients do not develop complications, and if they develop complication will be small percentage of patients.